Why can't people with addictions just quit? Or why is it so hard for an addict to stop?
Because your brain has been taken over. The reward circuit is something we all have. And for most of us, day-to-day experiences are sufficient to stimulate it and feel good enough and walk about. So a nice conversation, a delightful cup of coffee. It could be a brisk walk with, the wind in your face when you're in Madison in the winter. Those are all things that can feel enlivening and stimulate your reward circuit. However, for somebody who either has a genetic predisposition or is currently in the midst of an addictive disorder, what can happen is that the amount of stimulation you need is so much that you basically get disconnected from the ability to stop. So those cravings, the compulsivity is driving you. And we talk about, the lizard brain and more the human brain, where the human brain has the prefrontal cortex to control, and the lizard brain or the animal brain, often they're, just responding to things in their environment. And really in addiction, you can sort of move into that area where your prefrontal cortex doesn't quite play as much of a role. You're just responding to the innate needs your body and your brain have in the moment. And so that's really where it's hard to just stop, because your brain's running the show, that addictive, the reward circuit hijack is running the show instead.
Can you get control of your brain back?
You can. And I think that's really where treatment comes in, being able to, step away from the substance, often, again, in a supportive environment. Some people are able to gradually cut back use. It's not all the people. So I think, in other podcasts that you do, you might hear stories of people who say, I was able to do this on an outpatient basis. I was able to do it without treatment also. There'll also be people who say, I smoked cigarettes for these many years, and one day I just quit cold turkey. So it can happen. There can be different reasons for that motivation to come up. Different individuals may have different times in their life. It could be that you're no longer in as unsafe of an environment as you were before. And so suddenly you are able to step away. We talked about trauma earlier. If, say, you start working through trauma, either with a clinician or even through more reparative relationships in your life, you could get to a place where you can stop. But often it does take some level of environmental and situational change to be able to do that. We've heard of people who come to us for treatment who then say, you know what, I'm not going back to my prior city because there's just such strong associations. So often it takes for something in life to change to be able to get there.